The opioid crisis continues to plague the country, including right here in western Massachusetts. Efforts continue to save the lives of those who are addicted. One of the ways is a law called Section 35, where loved ones can have a family member committed to a treatment facility for help. I sat down with State Representative Michael Finn of West Springfield and Anthony Scibelli from the Western Mass Recovery and Wellness Center to discuss this ongoing fight to save lives of those who fall victim to drugs.
Section 35 is a chapter in the law that allows a person to go to the court and petition to have someone mandated to drug and alcohol treatment. Now, not anybody can just go to the court and petition anyone to get treated. You'd have to be what's considered a qualified person. So that would be a spouse, a blood relative, a medical professional, someone who works in the courts could go and petition.
And this would be for someone who's addicted, who is in serious difficulty, I would imagine, in terms of perhaps doing harm to himself, seriously along in the addiction trail?
Yeah, correct. When you petition someone at the court, then the court has to make a decision. Does this person, one, have substance use disorder? Are they diagnosed? They have to diagnose them with substance use disorder. And two, is there a likelihood of harm to themselves or others? So those are the two factors that need to be met. And
what happens if a family member does in fact go to court, Section 35, and they get their loved one committed for help? What happens after that legal process?
So once the judge remands them to treatment for up to 90 days, they'll remain in the court until they're transported to a treatment facility.
And here in western Massachusetts, can you talk about the treatment facilities that are available for those who are committed under Section 35?
Sure. Yeah. So prior to last May, there was 0 beds for people in western Massachusetts. Everyone was transported out east. That's what prompted Sheriff Kochi to challenge us to open the SSTC Springfield and Ludlow sites.
Okay, so you have, as I understand it too, that you've got a site in Ludlow.
Correct.
And there is another secondary site on Mill Street in Springfield. Is that correct?
That's correct.
How do the two differ, or how do they interact?
So the way it works is it's a step-down model. So everyone that gets sectioned to our program starts in Ludlow, where they have a medically managed detox, which is the most critical point in treatment. And
then they might transition into Mill Street.
Correct.
Okay, very good. Mike, want to get you in on the discussion too, because you are on a legislative commission on Section 35, and I think, if I'm correct, you're the only Western Mass member on this commission.
Yes.
Can you tell us a little bit about the history of the commission, why it was formed, and what its work involves?
Sure. In last year's state budget proposal, Governor Baker had proposed a 72-hour hold for folks that were suffering from addictions. And the legislature didn't agree with that. There's a lot of discussion about, taking someone's liberties away from them and the process that's revolve around, having that happen. And so as a result of the budget request that the governor had, the commission was created through the legislative process, and then all of the members of the commission came together, and we've been studying the procedure itself. Are there areas to improve on the actual process of Section 35 commitment? Is there ways to improve the Section 35 treatments themselves, in facilities such as the Hampden County Sheriff's Department or the RAP program, or, WOTC and different programs that are around the state. And so we've been, studying all of these issues, whether medically assisted treatment should be a part of a program, because some of them don't have medically assisted treatment, which is, really key these days to helping people combat the problem.
And I understand that you had a meeting on Thursday. Mm-hmm. Can you tell us what was brought up, what was discussed, what was the result of that meeting, what you heard?
Sure. So it's a part of the ongoing process of the commission. We've met, I think, 6 or 7 times already, and we have a few more meetings scheduled before the report is due in July of this year. And so at this meeting in particular, the Sheriff's Department came out to talk about the work that they're doing. And then in addition to them, the folks from the RAP program, which I believe is the Women's Recovery Addiction Program in the eastern part of the state. And then we had CPCS come in and talk about their position about the constitutional impacts to folks that are being Section 35. Because there's just so many different areas that come together when we start talking about a coerced treatment or involuntary treatment, which Section 35 is.
I think a lot of people would be surprised to find out that here in Western Massachusetts there is not a specific treatment facility for women, and that women have to go out of our region to get help. Why is that? Why isn't there a facility here?
Yeah, that's a great question. That is one of the things that prompted Sheriff Kochi to challenge us to open the site for men. Currently, we're legally prevented from opening a site for women. There was legislation passed that prevents women from getting that care in a correctional institution. Mm-hmm. But the Sheriff's Department has been involved with the 35 process long before us opening the Stony Brook sites. We are responsible for the transportation in our counties to the treatment centers in Eastern Mass. And several years ago, or a couple of years ago, the Sheriff Kochi, the Sheriff's Department transported a woman out east. And one of the most dangerous parts of treatment is the detox. And you can imagine someone getting sectioned on say a Friday in the summer and having to transport out east in the traffic. And you can be in the back of a van detoxing for upwards of 4, 5, 6 hours. And there was a woman that coded in our department, our staff, as trained, administered CPR and brought her back, and the ambulance came, and she perished in a hospital on the way.
Highlights,
sadly,
obviously, the importance of having a treatment facility locally, for women. And this would also, I would imagine, pose a problem in terms of the overall treatment program, because a family member, if they want to visit a loved one who's being treated, has to go all the way out to wherever, Eastern Massachusetts, just to see that member. Yeah,
that's right. There's a lot of reasons why it makes sense to treat people locally. The detox, limiting the time that someone, getting immediately a medically managed detox is a big one. Having family present and supports. I mean, our department has been treating substance use disorder, the disease, for since 1985. The building where I work, we've treated in that program over 17,500 men and women. We've built out a continuum of care to get. We have wonderful community partners in Western Mass, and if the men and women are going to get treated for this disease, they need to get connected with support where they're going to live.
And I would just add, Ray, if I can.
Sure.
There were reasons why. Women were removed from correctional settings. There was a lawsuit, and to be fair to the administration and to be fair to everybody involved, not all correctional institutions are created equally. We are blessed to have one of the best in the nation, but some of the other facilities that were providing Section 35 treatment were, to be frank, were subpar. And so there were reasons why women were removed from the correctional setting, and then but it's still. In my mind, as a legislator fighting for Western Massachusetts, is a significant problem for many of the reasons that you just stated. Families being able to visit their loved ones, the length of time someone might go without, medically assisted treatment for that detox, communications with their employers, visiting family members, like if for women in particular, children. And so, there's just so many reasons why this regional disparity is, in my mind, more significant than many of the others that we face.
Representative Finn, from a money point of view, is there money in the current budget that would be allocated, for example, to treatment facilities in Western Massachusetts that could, in fact, include a women's facility?
So a particular line item right now today, no. And so and when I say that, I should have an asterisk next to that, to comment. So what it is because there's no facilities that are either DPH or DMH licensed, and because the Sheriff's Department is prohibited, what we're doing is we're looking for a spot that would be able to accommodate Section 35 treatment. Now, because we don't have the location, we don't know how much it's going to cost, to potentially build out a site. We don't know how much it'll cost to potentially run the site. So as these numbers are being developed, and we're watching very closely and working in partnership with the Sheriff's Department and other legislative leaders, Chairman Leader Wagner as well, and Rep. Vilas and Senator Welch and everybody's got their eye on this ball. And when we get to the point where we're going to know what a dollar figure will be, there are pretty strong commitments all the way up the legislative leadership chain that money will be made available.
Okay. Anthony, in terms of Section 35. Now, if someone is committed, can you take us through the process by which that individual is treated? First, you say they go to Ludlow.
Sure.
It's a separate facility, I would imagine, from the facility that houses the inmates, right?
Yeah, absolutely. They have zero contact with anyone who's incarcerated. Yes, so they'll go to Ludlow for a medically managed detox, and like was mentioned, we provide several forms of medically assisted treatment, especially during the detox, and that's very important because it allows to limit the discomfort during detox and help them to engage in treatment sooner. And one of the things that we're really proud of is prior to a year ago, the average stay in a civil commitment was 21 days, which is far too short. You're basically just getting them drug-free before they leave, and it could be argued they're susceptible to, it's dangerous to relapse and overdose. And we've extended that in less than a year to 49 days. So they're engaging in a lot more treatment. It gives an opportunity to help try to create that intrinsic motivation, that change.
And that's got to be a critical component, I think, of the overall treatment plan. Then, in terms of having this individual come out of treatment and being able to, continue his or her life without going back to the addiction.
Yeah, absolutely. I mean, this is just the first step in treatment, and that's why, again, it's so important to do it locally so we can connect them, pass the torch to other providers, so they can continue on the path of recovery.
Representative Finn, you say that this report that the commission is going to be writing up for the governor will be coming out in July. Any bullet points, any highlights you can give us today as to what that might include in terms of priorities?
So there's no, at this point, it's more of a studying of the issue. And so there's many philosophies that exist on the commission within the commission members. Some people, and I guess I would fall into this category. I don't have an issue with correctional facilities managing this type of treatment. I don't. I think if you're saving the life, I think if you're committed to running a top-tier program, which the Hampden County Sheriff's Department does, that the stigma that goes along with a Section 35 commitment and being in a jail, I think that should be left at the door, because these people are doing phenomenal work.